As COVID-19 spread around the world, countries needed the same things: medical supplies and equipment, test kits to help determine who is infected, X-ray machines to check people's lungs, personal protective equipment to protect healthcare workers, hand sanitizer and soap so that each person could do their part to slow the spread of the virus. All of these things played a vital role in the fight against COVID-19. And all of these things were in short supply during the pandemic. COVID-19 disrupted supply chains around the world. It tested the resilience of global healthcare systems and exposed weaknesses in public procurement processes. The pandemic had far-reaching consequences. It put immense pressure on production and manufacturing, drove up costs of essential medical supplies, exposed violations of labor rights, and made the problem of medical waste more visible than ever before. But the pandemic also provided us an opportunity to learn valuable lessons and look at the ways in which we can make public procurement processes and supply chains not only more efficient and transparent, but also resilient and sustainable.
I don't think there is one playbook on how a country can respond and be more resilient. I think it's about learning what disruption really meant and then how best to respond.
Marcus McKay is a procurement specialist at UNOPS. His work focuses on developing policy to promote sustainable procurement practices.
Sustainability, in its simplest and most fundamental sense, it covers the environmental elements of something, the economic elements of something, as well as the social elements of something. Procurement in itself and public procurement has a huge potential because of its scale and its influence. In large economies, public procurement can represent as much as 12% of the GDP. So this allows procurement to be a vehicle or a conduit to have significant change and influence. And if you take some of the social elements of sustainable procurement, for example, how through purchasing power can you influence labor standards? How can you influence how you interact with the private sector and drive change? During emergency conditions, sustainability might not always be considered a priority. There's huge demand. There needs to be very quick mobilization. Distribution has to be very efficient. But I think that this is one of the problems that we have when it comes to addressing sustainable procurement practices, is where sustainable procurement or sustainability is segmented as an add-on or a separate element of procurement. These should be fundamental elements which are embedded into how things operate and not a nice to have. They should be part of what's demanded and essential so that we can meet the expectations of the global community as well as our responsibility to the environment and to the global community at large.
Experiencing firsthand the immense challenges that came with acquiring medical supplies during the pandemic was procurement specialist Nines Kosumi.
No one was expecting COVID-19 to hit the marketplace the way that it did. The whole world was trying to purchase from one marketplace, which did not have enough workforce to keep up the production with the marketplace demand, which then led to market prices fluctuating and changing constantly. And when we saw market prices fluctuating, the increase on prices on raw materials did not only affect the healthcare supply chain, it had a wider effect in other marketplace sectors such as infrastructure works, IT equipment. COVID-19 pandemic showed that not all countries are prepared for immediate response in the provision of adequate health services in such challenging environment. In general, I believe that relevant institutions, governments, organizations should reflect on challenges that we have faced in the last 2 years globally and all of the lessons learned during these challenging times in order to improve on our public health procurement process in case we find ourselves in a similar situation in the future. I think in doing this, it would benefit initially the health institutions to be better prepared and provide adequate and efficient healthcare for their population.
Transparent processes and supply chain analysis can help promote fairer and greener supply chains. They can save countries money, which in turn can help ensure countries are better placed to respond in times of emergency.
To build a more resilient and sustainable or stable supply chain, it's important to analyze and understand what the needs are. Fundamentally, supply chain analysis is your ability to assess what's going on in that supply chain. Now, you might do supply chain analysis on capacity, you might do a supply chain analysis on sustainability, you might do supply chain analysis on costing. So a supply chain analysis is how you choose to analyze different components of a supply chain. A very holistic supply chain analysis would obviously take all of those elements into consideration. I think the use of technology plays an important role because of the size, scale, and interconnected nature of supply chains. From a UNOPS perspective, we have thousands and thousands of suppliers globally. So for example, we can use big data as part of our supply chain analysis. And within UNOPS, for example, we analyze our suppliers from a sustainability screening perspective with a significant amount of data. And we use technology for us to be able to harness huge volumes of information in a more digestible or more comprehensive way for us to make a decision.
And by utilizing technology and applying the lessons of this pandemic, we can be better prepared for the next one.